Good afternoon, everyone. Thank you for joining us today. We will first hear from County Executive David Crowley. Then we will hear from Mayor Tom Barrett. Next, we'll hear situational updates from Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management. And Dr. Jeanette Kowalik, Commissioner of the City of Milwaukee Health Department, is with us today as well. Thank you all for being here, and County Executive Crowley will start things off with you.
Well, thank you so much. Good afternoon, everybody. Many of you have heard probably yesterday that the Milwaukee County Zoo will be partially reopening as an outdoor experience starting this Saturday. And so what this means is that we're going to have limited daily capacity for our visitors, and we'll require folks to go online to get a reservation in order to come into the zoo. So we want to make sure that we are protecting everybody. So we will have visual signs, staff members in place to remind folks to maintain 6 feet physical distancing along all the pathways. And we're really thrilled to announce this news because we want folks to know that as we think about this, a lot of people have not had the time to really enjoy many of Milwaukee County parks, our zoos, and it has had a huge impact on our budget. And when you think about our budget, as I said before, we're going to see about $100 million in lost revenue. We could be facing about a $450 million impact to our total budget because of the COVID-19 costs, which also hinders us from being able to do what we are achieving to do here in Milwaukee County, which is making sure that we're achieving racial equity. When we look at what has been happening over the past week and a half, we know that we definitely need to make sure that we're bringing as many people to the table and really focusing on racial equity at the end of the day. And so we are going to continue to talk about the lack of CARES funding that we have not received both at the federal and at the state funds. And so we need everybody's help in leaning on our state and federal delegations and making sure that we're bringing back as many resources as possible to make sure that we as local governments has that direct and flexible spending. We all, and when we think about the zoo opening up, this is definitely an exciting time. But we need to remind folks that we are still in the middle of a pandemic. And so we in Milwaukee County are going to continue to adhere to the CDC health guidelines in order to keep folks safe. And so for that reason, we're going to be issuing a universal face mask policy. So our employees, our contractors, vendors, volunteers, service users, and the general public who are entering our county facilities will be able, we're asking them to wear a mask, and it will be required. But we're going to make sure that we're also providing those masks for many individuals. And this is what we need to do, and not just in county facilities, but also within our airport and on our buses. So we're going to make sure that at those control points that we have masks available for folks. And acceptable face masks include cloth face masks, such as face masks that are handmade or sewn, scarves, bandanas, disposable face masks, non-medical grade paper, or procedural masks. For those who don't have a face mask, again, we're going to provide them. And like many other communities, we have spent a numerous amount of money on PPE for Milwaukee County employees, but also for the public. And with that, I want to make sure that we give a major shout out to organizations like Mask Up MKE, who we've been able to partner with in making sure that folks have access to masks. And I know people have been asking about children the ages of 3 to 12. We're saying that they should only wear a mask if a parent or guardian is really monitoring them to make sure it is safely worn. I do have a 3-year-old, and we do put a mask on her, so I know how difficult it could be really putting a mask on a child, but we want to continue to make sure that we are protecting everybody, our family and our neighbors. All children 12 years old and under must remain 6 feet within their parents or guardian or household unit, and those who are small enough should be in a stroller or cart. Children 2 or younger are exempt from wearing a face mask. And so these are our guidelines that are strictly based off of the CDC guidelines, and these guidelines will help us keep places like the zoo open and make us feel safe for all of us to enjoy. So please, please, please wear your face mask to protect you and those around you. And when we think about these face masks, when we think about folks going to different places and things slowly opening back up, we want to let folks know that if you don't have symptoms, it's extremely important that you, or if you do have symptoms, excuse me, that you get tested. And understand that just because you don't have symptoms don't mean you don't have it. And that's why we're asking people to wear their masks. Because Milwaukee County is an area of significant community spread transmission, we have to take the necessary precaution in making sure that we wear a face mask in county grounds and within our facilities. And we're going to continue to stress to make sure that you put your biases aside when you see people of color wearing your mask. The other thing I want to make sure that I touch on is beer gardens. Speaking of Milwaukee County Traveling Beer Garden will officially kick off at Framing Park in Franklin tomorrow, Wednesday, June 10th. I had the opportunity to go to Whitnell Park yesterday in Greendale for the official opening. And this is a time where people feel like it's spring and summer in Milwaukee. And we're taking the necessary precautions to make sure that we are protecting folks. So we're asking folks not to bring your own cup. We will provide those cups, single-use cups. We are preferring that you pay with a credit card. And we do have tables with one side with a brick on those tables, one side marked with the red, another side marked with the green. And so if you're coming to the park, make sure you sit at tables with that green marking showing. That lets you know that we have cleaned up and it is safe for you to come and enjoy. And so I know this is a favorite time for many folks as we think about the fact that we're leaving the cold weather, we're going into the summer, and we just want to make sure that we keep these services available to folks. But we just ask everybody to continue to respect and follow the suggested national health guidelines to guide us as we continue to go through this pandemic. And with that, I will hand it over to Mayor Barrett.
Thank you very much, Mr. County Executive. We appreciate everything that you're doing right now. I think every single one of us is keenly aware that over the last 10 days, the focus of the nation, the focus of the state, the focus of Milwaukee has been on the situation in Minneapolis and current relations between police departments and communities, particularly communities of color throughout our country. As a result of that, we're also well aware that literally thousands, if not tens of thousands of people have decided that they were going to protest or march or show their displeasure with the current state of affairs. I support those peaceful efforts for people to have their voice heard. And I think it's important for us as a nation to embrace our First Amendment rights. I'm also keenly aware that for the last 3 months, on virtually a daily basis, we have been talking to people about the dangers of COVID-19 and that this pandemic does not create exemptions for religious events, for sporting events, for voting, or for protests. And to that end, I remain concerned that what we're seeing right now could lead to a spike. I hope I am wrong, that we won't see a spike, but my fervent belief is anybody who is feeling any symptoms whatsoever, that they get tested as quickly as possible. If you are feeling the symptoms of COVID-19, please get tested. We've got our community sites on the north side and the south side. I'll touch on that in several minutes. What we have seen is frankly, a rather dramatic drop in the number of people who are getting tested. And I would like to think that's because everything is back to normal. I don't know the reason why we've seen such a dramatic drop. But again, if people are feeling the symptoms of COVID-19, I think it's very, very important for them to get tested as quickly as possible. Again, we've got 15 sites. You can call 211 if you're symptomatic. The community sites are there. There are now 4 community sites that people can go to and can get tested. But that's very, very important. So last Thursday, I announced at this press briefing that the city of Milwaukee would be moving from phase 2 to phase 3 of our Moving Milwaukee Forward plan into effect on Friday, which is exactly what happened. Commissioner Kwolek will talk a little bit about this later on, that we are now in phase 3 of our Moving Milwaukee Forward safety plan. We understand that there still are a lot of people who are concerned, a lot of restaurants that are concerned, a lot of bars are concerned, a lot of workers who are concerned about going back to work. And as I've said repeatedly, by issuing that order, we of course are not requiring any business to be open. And we are requiring them to follow safe practices. So to that end also, both this morning and this afternoon, we've already hosted sessions on our webinar, Moving Milwaukee Forward phase 3 for bar and restaurant owners. I was very, very pleased by the turnout. We were joined by, between the two webinars, 268 participants who wanted to get more information as to how they can safely reopen. So the goal of the webinars was to help the restaurants and bars understand what moving forward in phase 3 means for their businesses, for their staff, and for the customers. I was joined on the webinar by members of the Milwaukee Health Department, the Department of Public Works, the Department of Neighborhood Services, and this afternoon by the Department of City Development as well, because they're the ones that are running the Milwaukee Restart Grant Program. But we talked about issues like the Active Streets Program, which is going to allow for more outdoor dining, how to safely return to indoor service, how to keep customers and staff safe, and the city's expectations as they relate to inspections and enforcement. That to me is a big part of what needs to be done as well. I touched a little bit earlier on the testing. This week, the Northside National Guard site at Custer Stadium, which is across the street from Barack Obama School of Career and Technical Education, conducted 80 tests. So again, that's a dramatic drop from what we were seeing several weeks ago. The UEOC site conducted 206 tests, again, a dramatic drop from what it has been seen. On the South Shore, there were 206 tests that occurred. So the combined totals for the week are a little over 4,500. The combined overall totals are much more impressive at 27,000. But I want to remind people that the UMOS and Custer Stadium sites are available for symptomatic and asymptomatic, meaning if you don't show any symptoms, you can still be tested at those sites. Both sites are open Monday through Thursday, 11 a.m. to 7 p.m., Fridays and Saturdays, 11 a.m. to 5 p.m. They are closed on Sundays. If individuals were out protesting and again begin to feel the symptoms, please don't hesitate. Call 211 to find a testing site near you, or go to one of our community sites. So with that, I'll turn it back over to you, Catherine. Thank you very much.
Thank you, Mayor Barrett. Next, we'll hear from Dr. Weston.
Thank you, Catherine. Good afternoon. First to our numbers, we have 9,001 confirmed cases of COVID-19 in Milwaukee County and 301 individuals who have died. We updated our 5 key metrics yesterday and saw the care category turn from yellow to green as we're seeing a downtrend in COVID-19 patients overall in our hospitals. This is a positive change and a good trend for our community that we'll certainly keep an eye on. On the testing front, we've seen the number of people seeking out COVID-19 tests go down over the last few weeks, in particular over the last 2 weeks. At the same time, we're not seeing a downtrend in the percent of those tests that are resulting positive for COVID-19. So this combination of 2 factors suggests that we're under-testing in Milwaukee County and missing a substantial number of cases of COVID-19 in our community. This is likely first due to diminished awareness of the presence and severity of COVID-19 in the community. As we see stores, restaurants, and workplaces opening back up, there's a sense that we're done with COVID-19. On top of that, we've naturally seen our media and our public attention shift to the protests and the very real inequities, racial inequities in our country. Each of these factors likely leads to people thinking less about COVID-19 and less people feeling the need to get tested. Testing, however, especially testing with symptoms, is critical to controlling the spread of COVID-19 and decreasing the likelihood that we'll have a major future spike in cases that could strain our healthcare system and push us back as a community to stricter physical distancing measures. So please, if you have any symptoms of COVID-19, and to list these off, we're talking fever, chills, cough, shortness of breath, new fatigue, muscle aches, headache, a new loss of taste or smell, a sore throat, runny nose, nasal congestion, nausea, vomiting, or diarrhea. If you have these symptoms, seek out a test for COVID-19 and certainly call 911 if it's a case of an emergency. So as a reminder, there's 2 main ways to get a COVID-19 test in Milwaukee County. We have 2 National Guard testing sites open, one at Barack Obama School at Custer Stadium, and that's at 4300 West Fairmount Avenue on the north side. And then the UMOS testing site, which is at 2701 South Chase Avenue on the south side of the city. So these are free, no appointment, drive-through, and walk-up testing sites. Additionally, you can simply call 211, as the mayor mentioned, and based on your zip code, you'll be routed to a nearby healthcare affiliated testing site. You can schedule an appointment at those sites for a test, and that's regardless of income, insurance status, or immigration status. So although there is under-testing in our community, it's important to note we have the capacity to test many more people than we currently are. Both our health system-based sites as well as our National Guard sites are being underutilized, and they're able to test many more members of our community. So we know that COVID-19 is very easy to spread. So if you have any of those symptoms, it's critical that you're tested and able to self-isolate if needed to prevent broader community transmission. Get tested to care for yourself, to protect your family, your friends, and your coworkers, to prevent more serious illness, and in the end, to be a good citizen and keep our community safe. Please remember, COVID-19 is still in our community, and though we are opening back up, we need to be more vigilant than ever to ensure that we don't have to take a step backward in this fight. Thank you, and I will pass it on to Commissioner Kowalik.
Hi, everyone. Thank you for the opportunity to provide an update today. As Dr. Weston noted, as far as the number of cases and the number of fatalities from COVID-19 infection, the city of Milwaukee absorbs the majority of those since we're the largest jurisdiction in the county. We're about 7,200 for the city and a little bit over 200 for fatalities. We normally have our updates at 2 p.m. every day, so I'm providing you with estimates based off of the latest data that I had as of right now. So the concerns, though, too, looking at the inequities related to COVID-19 infection, how the Latinx or Hispanic population of our city now has absorbed the majority of the cases at 39%. The African American is 32%, the white is 11%, unknown race is 8%, and Asian is 5%. So definitely increased strategies are needed as far as outreach related to our Latinx community, making sure there's a culturally and linguistically appropriate outreach materials and really getting people involved in getting tested and providing some care. We do know that there are some solid testing points of care opportunities on the south side of Milwaukee or those areas of town that are predominantly Hispanic or Latinx. So we are looking at that too. Is there an over-testing situation happening on that side of town? But we do know, as the mayor noted and as Dr. Weston noted, that there is a decline in number of tests that are happening, not just at those community testing sites, but my understanding is some of the healthcare providers are also noting that there's been a decline in tests. Again, I know that we are at a boiling point in our country right now, and that there has been a shift in focus as far as advocating for reforms in law enforcement and just government in general related to anti-Black racism in our city and our state and our country. But we also need to acknowledge that COVID-19 is still here and it still causes injury, disability, and death. So just being vigilant about preventing exposure to COVID-19. I also wanted to talk a little bit about that if anyone has been involved in protests or demonstration activities, just some pro tips to make sure that you're protecting yourself, making sure you're wearing a mask or a face covering. Again, making sure you're wearing it properly. I've seen a lot of folks with this. I know it's easier to breathe that way, but the mask needs to cover your nose and to the bottom of your chin. It should be full coverage at that point to really have the maximum benefit. If it's not worn that way, you're pretty much defeating the purpose of wearing it. Also making sure that you're using hand sanitizer, 60% alcohol volume or greater. As you're out and about, you might not have access to a sink, but that you're sterilizing and using that as much as possible. And then, of course, social distancing or physical distancing, 6 feet from other people in your household. We have seen some of that, groups kind of spacing out in the protests and demonstration activities. If you are symptomatic, you're starting to get a sore throat or some of those other symptoms that Dr. Weston noted, or you're just concerned, say you're not going every day, like say you went maybe on Friday. The recommendation now from the Association of Public Health Labs is to get tested 5 days after exposure or the first sign of any symptom related to COVID-19. So again, it's the 5-day mark. If you start developing some symptoms, or again, the last time you went to a protest or demonstration, you should get tested. Again, there's a variety of free testing opportunities throughout the area, so please take advantage of those as testing is low. So you should be able to get in and out. You shouldn't have to wait too long. We know that many other providers also provide free testing, so that information is available on our website, 211. There's also a way for you to find out where we're at, or if you Google COVID-19 testing, it'll show you what the current testing opportunities are in our area. Also, I wanted to just talk a little bit about the phase 3 order, as this is where we're going to be for a while. We're anticipating that we'll be in phase 3 for a while. But the difference with moving through the orders is once we are at phase 3 or any phase, there's a review period. So we're waiting for one full incubation cycle to conclude before we reassess and move into the next phase. So we need to stay in this phase for 14 days, which means we will not reassess until June 19th or Juneteenth Day. So you should not receive any updates on moving into a new phase until that point in time or thereafter. If we're in yellow now, if we fall back to red in any category, that and by the time we get to the 19th, we're going to note that, and we're going to have to reassess every 7 days from that point on. So it's not like, oh, well, we're looking at now, and then we're looking at next Friday, and then we transition because maybe there was one red day, say, for testing. Then we say, oh, well, by this day we have all yellow. No, it's over the entire period. So please be sure to watch for that. The county is tracking too, although our indicators are slightly different. They're pretty much the same, the cases, the testing, the PPE, the care, and the contact tracing. My other point too about this, because I know we've received a lot of questions, and I just want to shout out my team, Deputy Commissioner Claire Evers and Deputy Commissioner Marlena Jackson, who really stepped up and helped with some of these webinars and creating opportunities to provide some answers to many questions related to phase 3 and how do we go about doing that for restaurants and bars, as well as many other sectors. So there'll be a series of a variety of webinars and opportunities to get clarity on where we're at. So I just wanted to highlight the point about outdoor patios and mass gatherings, because that's a big difference compared to where we were at in phase 2 and prior. The CDC states that if anyone in a group is high risk, so you don't want me in your group because I'm high risk, so 10 people, that's the max. It doesn't matter what phase we're in. They're saying anyone that has underlying health conditions or anyone that is over the age of 65 is considered high risk. So you need to keep that group small and make sure that there's social distancing or physical distancing, 6 feet apart, and then enhanced cleaning and sanitation. If you do not have a high risk person in your group, that they're looking at the lesser of the 3. So we saw people with the 250 and they were like, yeah, oh, I can do this and I can do that. Actually, not necessarily so. So under the phase 3 order, gathering sizes of 250 people or less must meet the lesser of the 2 criteria outlined by the CDC. So 25% of the total occupancy, that's building occupancy of the location established by your jurisdiction, which is the city of Milwaukee. And then 1 person for every 30 square feet of floor space that's open to the public. So you note that those 2 categories make a pretty big difference. So you can't just run with the 250. You have to look at whatever is the lesser of the 3. So I wanted to just clarify that because we have received a number of questions about that. We also know too that large group gathering applies to establishments that have the space for the safety protocol, so that there's adequate space for physical distancing of 6 feet or greater from another person or group. The best practices in place are meant to support the physical distancing. And this also includes outdoor spaces and patio. We know that those spaces are included in the capacity count. So it's not additional, it's part of what you already set up for. We also know that Enforcement has been a question, so who's going to enforce? Enforcement is still a reality because we have an order in the city of Milwaukee. We know that our surrounding jurisdictions have guidelines, and then those are meant to protect public health as well. But our order is enforceable. The Milwaukee Health Department staff, our inspectors, do have the right to enforce, as well as Milwaukee Police Department. Our concern again is trying to limit the spread of disease in some of these areas where there's more stagnant, where there's, like we're comparing the difference between, say, a gathering where people are sitting somewhere for 1 hour versus where people are moving through. There's a difference there. And I know that was a question a while ago between like grocery stores versus like faith-based gathering. So if you're stagnant, meaning you're like sitting in the same room, breathing the same air, what we're looking at is the level of risk associated with that. So 10 minutes is what we normally go with. Anything that's more than 10 minutes significantly increases exposure. Also, the concern about the distance, less than 6 feet, is where we're concerned. So looking at those 2 points, looking at being in a stationary, stagnant situation for more than 10 minutes, and then also the distance between the less than 6 feet. So please consider that as we're moving forward on that, so we don't have any issues, because we know that everyone is pretty, this has been a long year and it's only June. And we know that everybody's excited about getting things back to normal, but we know that there's caution that needs to be considered before we do that. So that's why with phase 3, there is a 25% cap for restaurants and bars. So again, that is enforceable. We know that most people are not coming in and sitting for like 7 minutes and leaving. Again, at 10-minute mark is what we're looking at, being stagnant and not moving through. So our website, milwaukee.gov/MMFS, is where you can find the updated order as well as any other supplemental materials about it. We also will be posting the webinar information. So again, they'll be specific to sectors. So we just have restaurant and bars. There'll be one for child cares and youth programs. There'll be one for faith-based. So again, just going down a list of all of the sectors. So pretty similar to what is listed in the table, this gating criteria table that we're using. So if there's any specific questions, we'll be more than happy to answer them. And we also have our Ask MHD COVID-19 email that is available, and we have been receiving a number of questions about phase 3 through this means, but we set this up so that we're not getting specific emails to various health department staff and then say someone's out or someone is busy meeting or doing things and they're not able to respond right away. We set that up to provide a quicker turnaround on responses. So thanks again. Stay safe.
Thank you, Commissioner. We have a few questions I'm seeing come through. So our first one is from Mark Stevens with CBS 58, and it's for Dr. Weston. He asks, if we continue to see a lack of use of the National Guard sites, do we run the risk of having the National Guard close those locations?
Yeah, so I think anytime we think of testing sites and the resources that go into testing, they're limited resources. And so we want to put those limited resources in the areas where they're going to get the most use and make the most impact on our community. I think we've tried to be very strategic in doing that with both the National Guard test sites as well as the healthcare system test sites. But certainly, if they end up not being in the area that are most used and the best use of those resources, then I think we'd have to rethink where best to have them. But right now, they're still seeing a lot of patients, but the numbers continue to dwindle. Certainly each week and really even each day.
Thank you. Our next question is from Jeremy Janine from Urban Milwaukee, and it's for Mayor Barrett. He asks, or he states that multiple businesses have expressed concern about the timing of last week's phase 3 announcement. Originally, it had been planned for Friday, Can you provide more context on why that announcement came early and what we can expect from the announcement of phase 4 and when that will happen?
I'd be happy to. And I think the one thing that we probably can all agree on, that there is no perfect way to do this. Because what we would hear and what I would personally hear from businesses is one of two things, or maybe one of three things, actually. One is I would hear from a lot of businesses who said, I'm dying. I'm only going to last another 2 weeks or 3 weeks or 4 weeks. I've got to open immediately. The second thing I would hear is, look, I understand that you've got a tough decision to make. I simply ask that you give us several days notice before you open up so that we can get our staff together, so we can get food into our restaurants. And then the third thing I would hear is, we're in no hurry to open up for a variety of reasons. One, we may not think our business is coming back yet to the point where we want to come back. We think that the coronavirus threat is still too real. We don't want to take any chances. So I would say that the reaction we were getting was across the board as to what people wanted. I would also say now, as I reflect on this, is that there probably was a pretty significant difference between restaurants and bars. And what I mean by that is, I think for bars, they don't need as great a leeway turnaround time. They don't, by and large, have to order as much food. They might have fewer employees, and they can turn on a dime maybe if they know that they're going to be open. And then the other side is that you're going to have restaurants who are going to need time to get their workers back in place. They're also going to need time to get food. When we recognized that we were meeting the criteria, I felt that telling people that on Thursday, which was after we had had the meeting with Commissioner Kwolek and her staff, that we had met that, I felt from a good government standpoint that that was something that we should share with the public. That gave them, in essence, 24 hours notice, which for some businesses made them happy. For other businesses, it was not enough notice. And then for other businesses, they may not want to have opened at all. And of course, for that group, there's nothing in the order that requires any business whatsoever to reopen. That's going to be your decision. But we felt that when we met those criteria, and really the linchpin, I think, and the commissioner might want to comment on this, was the testing portion, because there had been some challenges in getting that testing information onto the what I call the gated criteria board. We knew the tests had been performed, but they hadn't been entered into our system. But that's getting a little bit in the minutia. But again, I think the bottom line was, once we had the information, we felt that from a good government standpoint that we should share that and not keep that away from people. And so that's why we took the approach we did. Again, I know it's not perfect. If we can come up with a perfect way to do this, I'm all ears, because I realize that this is a really tough situation for a number of small businesses, and I'm very sensitive to that as well.
Thank you, Mayor Barrett. Commissioner Kwolek, did you have anything additional to add on that question?
Well, as far as the, having the data when we report where we're at, it's really important, because we're still, like, these indicators looking at, okay, how is the data getting from the various sources to us? We want to make sure that that's accurate. We don't want there to be any concerns about trust in government providing data-informed decisions. As we said, we're using science to guide how we're moving forward throughout this process. So we don't want to do anything that can compromise that. That phase 4 definitely is more open, right? So, moving from 25% for restaurant and bars to 50%. Other businesses have more opening too. So, like, giving more of a lead time in how businesses open is really important. But we also know too that as we're looking at these 5 indicators and the data that we're getting, addressing some technical delays and how information gets to us for it to be able to count, and then also looking at who created these measures. Do they make sense for the city of Milwaukee? Because we are the one that will have the majority of cases, the majority of fatalities, and we have the most complex situation versus anywhere else in the state. So we always have to be mindful and how we move forward and how we're able to communicate that and show that we're being transparent and accountable in our approach. So if we're doing our updates every Friday, which is what we agreed on, because that is technically the 1 week mark from when we had our first case on March 13th or Friday the 13th, that helps us to keep track instead of having things at different times during a week. It also helps us as far as having a clean cut point on when we are able to run data and make sense of the data and actually confirm that we are yellow or green or whatever status we're in. So, I just wanted to, express that there's some technical sides to this too, that we just need to be cautious about how we provide these updates. But we also know that we can't please everybody in the timing of releasing an update, giving people like a week notice. The data can change in a week. It would be very difficult to do that. So, I don't know, there was some concerns too earlier in the week. It was looking worse, like we had 3 reds and 2 yellows. So sometimes as data's kind of rolling in, we start seeing things improve. So I just wanted to put that out there, some of the challenges that we have as we're trying to make sense of the data and either say stay or go. But I wanted to just reiterate that you're not going to get another update until the 19th of July on where we're at.
June.
Thanks.
June. Commissioner, I think you meant to say June 19th, didn't you?
Juneteenth.
Yeah.
Mm-hmm.
Yeah.
Yes.
Yeah.
Thank you for the clarity. Thank you for the context, both of you. The next question is from Allison Durr with the Milwaukee Journal Sentinel, and it is for our health representatives. If there were to be a spike in coronavirus cases from the protests, what is the earliest that health officials would expect to see an increase in the number of cases? And if the indicators go back to red, could we potentially move back to phase 3 or phase 2?
Yes, I can answer that. So, of course, we're looking at the incubation period. That's why the phase movement is set by 14 days versus 7 days, because we want to actually have a full incubation period. That was set up before the demonstrations began. So we have a sense of when they began. I think it was the 28th or 29th of May. So we would count 14 days from that. And since they've been happening every day, multiple times a day, that will be like a rolling review of if there's a spike in cases. So we'll just continue to monitor, 14 days out. Again, since these are daily, this is going to continue to push that review period out further. And then, anywhere with a range after the 14 days of 3 to 5 days, we know that sometimes people's symptoms, they may be asymptomatic for the first couple of days, then not go in and get tested, then that adds to the clock. So, just being clear on that. The other question was about
If we have to move back in phase.
if we have to move back. So the way that we have this set up now is phase 3 is kind of like our landing point. So I would just temper expectations that we should probably be in phase 3 for a while. And then we'll continue to reassess again as these are rolling demonstrations where we're at. I would anticipate seeing, by next week, we might, if we go back to red in one day throughout this period, we're going to be stuck in phase 3. And then we reassess 7 days. So the following Friday from that. But unless things got really out of control, then we would talk about having some more strict orders in place. But right now, it's pretty much like phase 3 is kind of like the landing pad for us for a while. If we move into phase 4 or phase 5, then we would roll back to the previous phase. So this is why we're pacing it, why we don't want to rush this process.
And just a quick comment. So when we look at spikes in cases from the protests, I think we've certainly seen before with previous protests and with the election, it's extremely challenging to tie spikes in cases to specific events. I think that'll probably be particularly the case this time around because it's at the same time as reopening in many communities. It's at the same time of changes in testing capacity and the type of testing that's going on in a lot of communities. So there's a lot of confounding variables that will be involved in any spikes that we see.
Thank you. County Executive Crowley, Allison Durr has a question for you as well. She asks, what difference is reopening the zoo expected to make on the county's projected revenue shortfall?
That's a really good question. I can't give you any numbers right now, but I think that when we look at opening the zoo, it's going to have a positive impact, not only just on our revenues, but in general. We see our parks opening up, beer gardens, as we mentioned before. We want to get to a place of normalcy for our Milwaukee County residents and those surrounding us. And that's why we're talking about wearing masks and making sure that you're practicing physical distancing. So I would say we don't know, but we do see an increase of, for example, our golf courses. We've seen more people utilizing our golf courses, probably at record numbers, I think, right now. And so I think that when you think about all the tension that has been being built up for the past 2 months, we hope that many families will come out and enjoy the Milwaukee County Zoo while practicing physical distancing.
Thank you, County Executive. Sean Kirby with Wisconsin Health News has a question for Dr. Weston and Commissioner Kowalik. He asks that, or states that county data shows a third of cases in Milwaukee County are Latinx, but Latinx accounts for around a tenth of the total deaths. Are there some reasons for the differences in this proportion?
So we've been discussing this. Obviously, there's a variety of other factors that need to be analyzed a little bit more deeply before we can provide like an official responsive report. I know that there's some adjunct type of things related to culture and practices that could be considered, but definitely, you know, there needs to be some more analysis behind the lower fatality rate for COVID-19 among our Latinx population. So Dr. Weston, I know you talked about this a little bit more if you wanted to add.
Sure. So yeah, so certainly as data continues to roll in, we continue to watch these numbers, and I think these in particular, the Latinx community is our highest right now as far as in our race ethnicity category. It's far and away the highest for the number of cases in our community, which is quite different from the demographics of the amount of our community that's made up by the Hispanic population. So I think there's probably three main possibilities of why the number of deaths is relatively lower to the number of cases. I think one is simply over-testing. It is possible that due to the UMOS test site, due to good community resources like 16th Street in that community, there's a lot of tests that are happening. And the more you test, the more cases you find. That's one possibility. I think it's probably a little less likely a possibility than the other two. The second one is that there's various, and this is what Commissioner Kowalik was talking about, there's various protective factors that may lead to less deaths in the Hispanic community. So those protective factors include age distribution. So we're seeing that younger ages in the Hispanic community are having higher levels of COVID. When I say younger ages, I'm talking 30s, 40s, 50s, as opposed to 60s, 70s, 80s. And those populations typically do better when they are positive for COVID. Congregate living would be another one. We see in our Hispanic communities less of the population in congregate living facilities, so long-term care nursing home type facilities. And we know those are communities that are at higher risk just by the nature of their design and setup and population. There is the possibility that our hospitals have had improved care. And so maybe somebody who has COVID now is going to do better than somebody who has COVID right at the beginning of the pandemic. We've learned a lot about how best to treat it from a clinical perspective. And then there's also, we see in a lot of diseases, heart disease, diabetes, obesity, we see what is known as the Hispanic paradox, where there's higher rates of some of these diseases in the Hispanic community, and yet there's lower death rates. And that's a whole nother discussion and lots of reasons why that occurs. So those are the first two, over-testing and protective factors. The last one, the one that we hope is not the case, is that deaths are our most lagging indicator. And so that's to say that first we see in any community, we would expect to see an increase in the number of cases. And then we would later on, a few days later to a week later, expect to see an increase in the number of hospitalizations. And then later on from that, we expect to see an increase in the number of deaths. So it could be that the reason why deaths are lower is because it's a community that's more recently affected. We hope certainly that's not the cause. I think it's probably a little bit of a combination of all three of these, most likely the latter two, protective factors and the lagging indicator. But as Commissioner Kowalik mentioned, it's something we're very aware of, watching very carefully and continuing to analyze and try to determine how best to shift resources appropriately to mitigate the disease as much as we can in that community.
Thank you both. Allison Durr with the Milwaukee Journal-Sentinel has another question for Commissioner Kowalik. She asks, has the city received any complaints about any establishments ignoring capacity limits under phase 3? And if so, what steps did the health department take?
I haven't received word of any violations yet. I mean, I know that there's a lot going on. I think there was some questions of who's going to enforce, just reminding restaurant and bar operators that, they are licensed, the health department, inspects. So our inspectors are going out again, and you'll start to see more activity there since we're in phase 3. So again, there's compliance as having being a licensed operator in the city of Milwaukee, and then of course citations if there's violations. So just, again, if there's concerns, we are taking any complaints through the CEH admin at milwaukee.gov email address. I'll post that as well as the phone number. Again, that's regardless of there being a pandemic, that's what you do if you have any issues related to food inspection problems, say food poisoning, whatever, that's the resource to use.
Thank you. And the last question I'm seeing is from Will Cushman with Urban Milwaukee, and it is for Commissioner Kowalik as well. He asks, is Milwaukee County tracking access deaths within the county? And if so, what does this data say broadly about COVID-19's impact on Milwaukee and surrounding communities so far? If the county is not analyzing deaths in this way, why not?
So I do have some of that data, but it's not up to date. My current update from the medical examiner's office is from May 21st. So from that point on, I can just give you the difference in categories. But for homicides, as of that date, 2020, we had 67. For 2019, we had 39. For accidents, 2020, 355. For 2019, 309. Natural deaths, which includes 246 of COVID, 1309 for 2020, and then for natural deaths in 2019, 1912, or not 19, 912, so 912. And then for 2020, suicides, 48, and 2019, 50. So just noting that if there's any natural deaths that occur, the natural deaths that occur in Milwaukee County are related to hospitals or hospice care. Any natural deaths that occur, this is those deaths are, those majority of natural deaths that occur in Milwaukee County are in a hospital or under hospice. Those deaths are not reported to the medical examiner. So let me just clarify that.
All right. Excellent. And one point of clarity for me is that Will had asked the question for Wiz Context, not Urban Milwaukee. So thank you for clarifying that, Jeremy. I believe those are all the questions I'm seeing. So thank you all.
Catherine, this is Tom Barrett. There's one thing I want to add, and if Dr. Weston is still on, I think you can help me here, because I think part of the theme we have here today is because of the nice weather, because people are tired of this, because of the protests and marches, we want to make believe that we are through this. And the numbers have been better. The numbers clearly have been better. And I think we're all very, very happy. I know we're all very, very happy about that. We're seeing the hospitalizations go down. We're seeing the deaths go down. We are seeing an increase in the Hispanic community. But as we sit here, I look back because I have my dashboard here from April 7th, which was election day. And on April 7th, we had 1,324 cases in Milwaukee County. And on April 7th, we had 49 deaths in Milwaukee County. And Dr. Weston, you can correct me, or maybe you can give the figures. I thought today we surpassed 9,000 cases in Milwaukee County and 300 deaths in Milwaukee County. So we've gone from 1,324 to 9,000, if I'm correct, Doctor, and we've gone from 49 deaths to 301 deaths. So it is still here, and we all know that there's a chance it's going to get worse, but I don't want anybody to say, oh, well, we're done with that.
Yeah, no, I think those are really important points. I think I would say there's not just a chance it's going to get worse. I think it will get worse. It may not get worse in the next month. We may, oftentimes with pandemics, when we look back at similar pandemics, they go into a lull for a month or 2 months, not necessarily weather related. It's unclear why, but viruses tend to do that. And then they tend to come roaring back harder than they've ever been. We've seen that time and time again with pandemics similar to this over the last 110 years since we've been tracking these. And so I think it will come back. And I think we need to stay vigilant. And I think it is extremely easy to fall into, I've said this before, I find myself doing it. You fall into this mentality that it's warming up, where, you know, the pace of everything is slowing down a little bit as far as COVID. You're seeing it less in the news. And it's coming to an end. But as much as we'd like to believe that, it's not. And so getting testing, knowing what's going on in our community, our numbers do appear to be improving, but the less testing we have in our community, if people with symptoms are not getting tested, they're not just hurting themselves. They're not just hurting the people around them by spreading disease, but they're also making it a whole lot harder to really understand what's happening in the community. Are things getting better? Are things getting worse? Do we have to modify our resource allocation? So I would echo everything the mayor just said, that we need to continue to be aware. We need to continue to utilize testing sites and continue to ramp up our resources. Thank you.
Thank you all very much.
Thank you both for that historical context and reminder, and reminder of why we still host these briefings and we're all here today. We appreciate it, and we'll continue to share those updates on Thursday.
Thank you.
Thank you. Take care.